Good morning. Today, I would like to share some experience of our organization to use NHRI data for building empirical data that can be useful for the government. And actually, certainly, our NHRI is facing many challenges. So we need reforms always. But what should we do to improve the payments system? What should we do to improve the benefits systems? And actually, our NHRI knows directions and possible strategies. So our organization, what can we do to provide additional assistance? So what we are doing is using data in the NHRI system to improve the performance of the system. And we do this by generating more information for better public communication and for faster response to healthcare need. And for doing this, we have tried to formulate a series of methods. And there are 4 sections. And the first section is for building databases for better monitoring resource allocation. And the second is for building databases for better prediction models. And the third and the fourth are about how we can build models for taking care of younger generations. And the first is for seeing the big pictures of our systems. And we do this by taking good features of our NHRI data, because in our NHRI data, each record reflects many features, including features for consumers, providers, care settings, disease types, service quantities, and service prices. And this can make us to build databases with multiple level structures. And when we have such databases, we can use combinatorics to decompose expenditure growth. And this can give us information about who, what, where, when, and what reason that we should pay more attention to. And this is an example by decomposing NHRI expenditure growth from 2003 to 2018. We found that the expenditure amount doubled in 2018. But this is measured by NHRI points. So it's not by real dollars. But anyway, the amount had increased a lot. It was doubled. And 20% of the growth was from cancer patients. 7%, almost 8% was from ESRD patients. And from patients with chronic disease, the contribution was almost 50%. So the messages tells us why we have to pay so much attention to treating cancers. And this also gives us information about why we should try very hard to reduce the number of ESRD patients. And finally, chronic diseases cause much trouble for our system. And it's not just for Taiwan, I think globally. So how to reduce harms from chronic diseases is certainly important. And when we have such data, we can have a better communication with the public about why the government has to pay so much effort and pay so much money for reducing harms from cancers and chronic diseases. And after finding certain specific population groups, we can go further to details for more investigation. For example, we found that statins are good for protecting DM patients. So actually, some years ago, the public has had concerns about paying so much for statins. But actually, if we use the somehow expensive drugs, actually, we have a better curative effect for patients. But the problem is our system has more and more people with chronic diseases. And it's not just about aging, because the incidence age of a DM is getting lower. So we are getting sicker somehow. We have a good performance for curative care, but preventive care is not enough. So that's a big problem. And also we found that after 2016, more elderly people with little risk have used much more expensive ultrasound. And actually, it's about a kind policy from NHRI, because the NHRI pushed a tiered care system. So the local hospitals and clinics can also provide somewhat expensive ultrasound. But certainly, some providers may take advantage of the good policy. So this is also a problem. And when we have the data, we can have a better communication with the public, why the government has to adopt certain measures to stop this. And we can also use the data to negotiate with individual providers and persuade them not to take advantage of the system. And this is a list of important NHRI policies aiming to improve care delivery and expense control. So when we have the database with multiple structures, we can contrast the trends in healthcare patterns and also expenditure with the trend in policy change by time series data analysis for aggregate data. And we can also do some longitudinal data analysis for individual data. So by doing this, we can generate more empirical data for the government to design new policies and for better communication with the public. And for the second part, we would like to show that administrative data are not just for administrative use, because we can transform the administrative data into good tools for predicting disease incidence and prognosis. And this can help us to have a better response to a healthcare need. And the idea is that in the real world, actually, the features of one person is changing over time. And also the effect of one characteristic is also changing over time. And our NHRI data has a history of 30 years. So the data can help us to capture the changes over time. And we use the good feature of the administrative data to build an inquiry system on mechanical ventilation performance. And this is good for a discussion between physicians and the patients. So it's helpful for shared decision making. And this is some information shown on the inquiry system. So it can tell us for a patient, ESRD patients aged 65 to 74 without consciousness. So on the 60th day of MV use, what's the chance of being alive without ventilation care. So this is another example on the inquiry system. So this is helpful for the healthcare professionals to communicate with the public and the patients. So it's not just recognized by physicians in Taiwan, but also globally. So we shared the experience globally. And this is another example of sharing our experience internationally. So in Taiwan, the data are also used for lectures in medical associations and also in some guidelines. And actually, Taiwan's NHRI data has much information. It has information about demographic and social conditions, disease history, treatment patterns, medical use, medication use, expenditure, and also characteristics of healthcare facilities. In addition, the Taiwan government also collects much data in other factors influencing health. So when we use the data, we can actually build much risk prediction systems for important issues such as ICU patients' long-term prognosis in the hospital settings. And also for the community settings, we can build prediction models for DM patients' risk and the CKD incidence. And by just using data in the NHI system, the administrative data, we can have a model with good performance. And in the future, if we also add data from other factors, hopefully we can build a very strong systems for the healthcare system to respond quicker to healthcare need. And this system can be especially helpful for rural area people because they need quicker response to their healthcare need. So it's not just about efficiency, it's also about equity. And finally, because after year 2000, actually, we can collect data since birth for each child born in Taiwan. So this is very useful because population aging and also low fertility. Certainly, we have to take good care of each child from the very first day of life. And this is good for protecting young generation's health over the whole life. And this is a figure showing how the Taiwan government has collected data about birth, healthcare use, cancer, and cause of death. And we can link data of biological parents and children, and even to grandparents. So this is good for building a good system for taking good care of each child's health. So these are some examples of building risk prediction systems for children, especially for children in rural areas, because we need to provide more help to children with complicated chronic diseases. We have to give them more transportation help and other kinds of help. And with good use of data collected by the NHRI and also other governmental agencies, we can expect more and more good use of data in the system to improve the performance of the system. And we can expect a better future for our NHRI. And hopefully we can also share more such experience globally. And this ends my presentation.